In this video, we will demonstrate how to place a naso-oesophageal feeding tube in a cat. The same process can be used to place a nasogastric tube, with adjustments on how to check positioning and measurement for placement. Prepare equipment before you start. You will need an appropriate tube, usually between 3.5 and 5 French, a marker pen, tape, local anaesthetic drops such as proximeticaine, glue, sutures or staples, and an empty syringe, and a syringe of saline. Appropriate sedation may be needed. Naso-oesophageal tubes can be placed in conscious cats using cat-friendly handling principles, such as a calm and quiet environment out of sight of other cats and dogs. For some cats, mild sedation with butorphanol or gabapentin, for example, could be used. Conscious cats should be positioned on a comfortable bed in sternal recumbency. Local anaesthetic is applied into one nostril. The nose should be elevated to allow the liquid to flow into the caudal nasal cavity. Allow at least 1 to 2 minutes for effect. Whilst the local anaesthetic is taking effect, measure the tube from the nares to the 7th intercostal space and mark the tube with pen or tape. For nasogastric tubes, measure to the last rib. Lubricate the tube and insert into the nose and direct ventrally and medially towards the opposite ear into the ventral meatus. The tube should pass easily and without resistance. The patient may swallow when the tube passes the oropharynx. If there is resistance or the cat reacts strongly, then stop, apply further local anaesthetic and allow time for effect before trying again. If the cat becomes anxious or fearful, consider further sedation. The tube is passed to the level of the tape or marker. The tube is secured with a suture, tape and staple, or tape and glue near the nostril on the muzzle. Correct tube placement should be confirmed by applying suction to the tube and achieving a negative pressure for naso-oesophageal tubes, not nasogastric tubes. Instilling air and listening to the cranial abdomen for borboigomal sounds. Flushing 3 to 5 ml of sterile saline and monitoring for a cough, which would indicate incorrect placement. Or using radiography, fluoroscopy, or capnography. For nasogastric tubes, some gastric fluid will be aspirated on suction of the tube. Tube placement should be checked prior to each feed. The tube is flushed with 2 ml of water prior to and after each feed to prevent obstruction. Body temperature, well-mixed liquid food is fed slowly via the tube, monitoring for any signs of nausea, restlessness, or cough. Stop feeding if you have any concerns.